one of the greatest challenges probably after graduation is joining a practice that has someone or a number of people who can mentor you. This is critical, and it could make life so much easier and your journey much more easier by identifying someone who would be able to hold your hand and if something goes wrong, and something will go wrong, that they could tell you, oh yeah, Khaled, step aside now, let me help you with this one, or how you can do this, or I can go to them and I've got this case, what do you think? And this is important till this day.
Hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. I'm your host, Laurence Doan, and today we're joined by Dr Khaled Ahmed. He is a senior lecturer in prosthodontics in Griffith University. He is an examiner of a RACDS and delivers the RACDS Masterclass in clinical examination techniques and dental imaging as part of the college's CPD program. As an avid believer in the lifelong learning, Khaled's professional developmental journey spanned the USA, UK, and Hong Kong for the past 17 years of his career. His expertise is in digital dentistry and toothwear. Dr. Khaled Ahmed, welcome to the show.
Thank you for having me, Laurence. Just a quick correction. It's Khaled Ahmed.
Khaled Ahmed, sorry about that. So, tell us about your CPD dental journey so far.
Well, it's been quite extensive, and it covered a number of different countries. So I did my primary degree in Alexandria in Egypt, and after that I did my fellowship in prosthodontics at the University of Illinois at Chicago, and then I moved to the UK, where I did my restorative dentistry residency in Newcastle upon Tyne. So restorative in the UK is perio, endo, pros, and operative, so all four. And after that, I was teaching full-time at Glasgow, and I was doing a part-time PhD. And then when I joined Hong Kong University, I also did a Master's of Laws degree in Medical Law and Ethics. And now I'm at Griffith in Australia.
Yeah, well, let's get back to that very beginning. I mean, did you think that you're going to be where you are now, like talking about the academic side of things to get to this point?
No, absolutely not. Absolutely. So each one of those steps was not planned. It was absolutely not planned. It was just opportunities, and I adapted my expectations based on the opportunity that was present, and I went for it, and it worked out fine in the end.
Yeah, well then talk to me about, because a lot of our community are very recent graduates. So you've graduated and now you're looking into, how did the fellowship of pros and implantology kind of come about?
So I always wanted to continue my postgrads, and they had started this fellowship program at UIT in pros and implant. And I was keen on that, and we were back in 2006 or 2005, yeah, around that period of time. And then I saw it, and we were just talking about implants. It was starting to boom, the whole field. And I was like, I want to do that. And so, contacted the program director, and I told him I'm quite keen on it. What are your requirements? And so on, read their handbook. And I ended up getting accepted into the program. And the rest is history. So flew out and went to Chicago.
Right. Were you working as a general dentist at the same time, or you were teaching or tutoring at the same time then?
So yes, at that period of time, I was working in a private practice, and I was also doing an internship with the university, which I completed. So once that was done, I was already more or less planning for the move in Chicago, especially at the end. Completed that and flew out.
Yeah, and then after that, you continued on to do more restorative, yes. A master's in restorative dentistry.
Yes.
So how did that kind of come about? Because obviously at this point, most people would think, hey, I've completed a fellowship in pros and implant. I feel like I've got so much knowledge now, but you compelled yourself to go and continue that.
Well, it's actually the other way around. So as soon as you graduate, you think that you've got a very solid grasp of dentistry as a whole, and you're good to go and everything is good. But in actual fact, the more you know about a specific field, the more you discover that you don't know that much. So you keep knowing more and more and more, and you'll find your footing which areas that you like most. So I decided early on that ortho and peds is just something that it's not for me. So that was, oh yeah, absolutely. No. Very traumatic for me, for the kids, for everyone. It's just not my field. Oral surgery was okay from a surgical perspective, where you're placing implants and so on. But again, it was something that wasn't that intriguing to me. So afterwards, after Chicago, the Newcastle at the time had some of the best restorative dentists, probably in Europe, some of the best in the world, and they published this seminal book, which is a reference for restorative dentistry, specifically the crowns and extracoronal restorations. It's by Robert Wassel, Angus Walls, Francis Noel, Nick Jepson, and others. So this is one of our main references here at Griffith, even before I joined. And I trained with those people. So again, when I was keen, I was like, I want to study more. This is a field that interests me. Again, that opportunity popped up, and I contacted Robert at the time, and I told him I'm quite keen on it, and I joined their program. And I think it was probably the best part, most influential part of my training was those years in Newcastle. So it's quite good having someone to. So Bob is quite meticulous, and he used to breathe down my neck. Each and every step, they have to be done to an absolute excellent standard. And in many ways, it's helpful to have someone like that. It could be stressful, I give you that, but it's helpful having someone vetting everything that you do and teaching you how to do it the correct way, or the way that they think is the correct way based on evidence. So that was exceptionally helpful. And then completed that. An opportunity for doing a PhD, fully funded PhD with Glasgow popped up with the job. So you're teaching full time and doing the PhD part time is all sponsored by Glasgow University. Again, I never dreamt of doing a PhD. It wasn't on the cards at all. Opportunity pops up. Yeah, went for it, and it was very good.
Right, yeah. So, I mean, I think you've touched on a few points here. You've talked about how when you kind of graduated, you wanted to dive into it because implantology is this new field that you're interested. You wanted to explore it a little bit more. Because for a lot of graduates, when they graduate, they're thinking about ortho, they're thinking about implants. I need to go and learn all of this really quickly. How do I kind of get on top of it? And that's kind of what you did. But then after doing it, you realize, wait, I need to come back and get on top of the bread and butter stuff first. And really hone in on that before going back into it.
Yes, it's very important to get your foundation right. If that foundation is solid, the rest is easy. So these little additions, the cherry on top, that's the easy part. So especially now with implant placement, it's the companies, the technologies advancing, the companies are making it even more accessible and more straightforward. You've got a fully guided surgical guide and so on. For many cases, it's straightforward, but it's the fundamentals. So unless you're going to limit your practice to implants, you really need to get on top of your restorative. When I say restorative, I mean the broader spectrum of restorative, periorendo, postoperative, and treatment planning and so on. As opposed to just being focused on placing one implant, restoring one tooth, and so on. So stepping back, stepping away from that an item-based or treatment-based or a disease-based approach to managing a patient or treating a patient, but stepping back and take a more comprehensive approach to managing everything, starting from oral hygiene prevention and so on, all the way up to maintenance.
Right, yeah. And then what you really kind of got out of that restorative dentistry was being very meticulous about the smaller things. Is that where you got away from that?
Yes, and understanding that each step in that process is as important as the end result, which is rather than mistakes do happen. Things don't go as planned. That's just a part of life. The worst thing is to be in a position where you're doubting yourself. Well, should I have taken a second impression or a better impression? Maybe I should have spent more time on ensuring that the perio is stable or in order, or the patient is on top of their oral hygiene. Or it's that self-doubt, and you don't know whether it's just statistics, whatever the percentage of failure, everything is going to fail or has a percentage of failure, or is it because of something that a second try-in would have helped or totally changed an outcome? These small steps, the build-up of it, is very important, but also having being part of a team where your arm is your dental technology, for example, especially with pros, that you could trust. You trust their work, you trust their steps, and if they send you back something, tell you, that this impression is rubbish. It's rubbish. You need to take another one. Just trust them. Yes, I really need to take or make a second impression.
Yeah, I guess earlier on we can kind of we have to dig really deep to kind of be critical of ourselves. Sometimes we just like to blame someone else for our mistakes.
Well, yeah, absolutely.
Yeah, so at the same time, so you're doing these masters and you're working at the same time, is that right? Or you're studying at the same time at this point within the university you're lecturing?
So the masters, I was doing it full time. The PhD, I was doing it part time.
Right. And then so once that's all happening, so now you're in this situation where like you were thinking you're being a clinical dentist, and then all of a sudden now you're slowly transitioning into this academic in dentistry. What's kind of going through your mind at this point? Because obviously you're seeing your other colleagues that are, excelling or, progressing in their life in the terms of clinical dentistry, because academic dentistry isn't really talked about or explored all that much, because you don't see, posts online about it. You don't talk about, there's no glamorous side to it.
This is quite the interesting question. So there seems to be a perception of a schism between being a clinician as opposed to being an academic, which could be the case in many people who have shifted totally into a research-based position with academia. So they're just doing research and so on. Or for certain fields such as epidemiology, for example, it's mainly about screening or prevention and so on. So minimal dentistry. That wasn't the case for myself or with people in the restorative who have their hands wet, really, where you're in the UK, for example, I had a position as a senior house officer where I also would see patients, but also the clinical teaching of it. We've all been students, and you know that, especially at the beginning, there is a lot of holding hands, and you know what, we're running out of time, and this patient really needs this denture, so let me just go in there. Let me show you how it's done. And if the supervisor is not on top of their game, it's not going to work. Simply, it's not going to work. It's going to be very challenging for the patient, very challenging for the student, very challenging for the supervisor themselves. So you have to be actually a good clinician in order to be able to do clinical teaching. If you're not, really, you're not in the right place. That's one part of it. But also the fact that you think, yeah, so people have moved on. Similarly, if people who graduated and went ahead and opened their practices and they have their own patient pool while you're still slaving away studying full-time or doing whatever, you can't help but think, okay, well, they're out and about, they're earning higher income than I am while I'm studying. Maybe some people or many people would be in debt and so on. But the bottom line is, the way to think about it is like an investment. So the earlier that you invest in yourself, every penny that you invest in yourself, in your continuing education, trust me, in the long run, you're going to get multiples of returns of that investment. I assure you. One thing that I'm absolutely confident about is that investment will be very profitable in the long run. Just, keep at it. And what better to invest in than in yourself? Not in a house or you could buy many houses later on. That's not the issue. The issue is becoming a better dentist, learning, but also takes a lot of courage and humility, because none of us like feedback. Let's be honest. Well, critical feedback. But the fact of the matter is, you're going to be good at things and you won't be good at others, and you're going to learn them. Just give it time, believe in yourself, and hopefully you're going to have someone who holds your hand, even in private practice as a mentor, someone who comes along and is like, you really shouldn't have done this. You really shouldn't have done this. If I was you, I would have done A, B, C, and D. That's learning. That's learning. As opposed to being upset or defensive. It's about insight. But we do it also self-reflection. I reflect, maybe I should better myself. Taking that critique from someone else also takes a lot of courage and humility and acceptance, especially if you trust that person or that person has the skill and knowledge that is necessary to give you that critique or feedback. It has to be mutually respectful feedback.
So once you're finishing your PhD, it's not too long before you start to consider this membership into the Royal College of Surgeons. Is that right?
Yeah, yes. Actually, I was quite late on that one. I was very late. So usually in the UK now, most graduates will start their part one of the membership, whatever membership of the Faculty of Dental Surgery, or the membership of the Joint College of Dentistry, whatever membership it's going to be. But they start that pathway of membership as soon as they graduate. And most candidates that are accepted in postgrad studies usually will have a membership qualification. So I actually started quite late in that track. And the aim is that you complete your membership, you do your postgrads, whatever, continue private practice. And after that, once you've got a few good years, 7, 8, 10 years of experience, you then go ahead and continue onto your fellowship. And then that's really doesn't get any higher than that. So yeah, my journey started a bit later with this membership. So in my congregation for the membership, one of my students that I had taught in Glasgow was sitting right next to me, receiving also her membership.
Right. So, I mean, whilst you're in that transition from that membership to that fellowship, you decide to do a Masters of Law?
Yes.
So how does that kind of come into the whole picture of things?
So it's again part of the continuing professional development. So the field of medical legal aspects of dentistry is a growing field, and it's very, very important. And it's again about self-reflection and also giving feedback and understanding what's going on with the basics, from consent to if something goes wrong, what do you do, to being an expert witness. So it is quite interesting, and it also ties in with your postgrad education. So it would be very difficult for you to be an expert witness, as for example by the Dental Protection or the Australian Dental Association, or by ABRA, to write an expert witness report in a case. If you're not clinically skilled or unqualified, you really shouldn't be taking such a request. They probably won't approach you, or approach me if I wasn't qualified for that. Second thing, it helps a lot having that medical legal background in order to be fair and assess the situation from a different aspect, because it's very different. Humanities is very different, Laurence, to what we do. We're used to, I'll give you an example. When you write a research paper, you've got an experimental design, you've got hypotheses, methods and materials, you come up with results, and then your discussion is based on those results. That is different from humanities. Humanities, you're sitting there, you're pontificating, you have to tie things with ethics. You have to, because it's not just law, but it's law and ethics. And the principles, and look at much larger picture, and it's your opinion. It's no longer data or this is my experiment. If you don't believe me, go replicate the experiment and see whether you get the same results. That is not the case. It's logic, it's common sense, it's critical analysis, critical thinking. which is quite difficult if you're not used to doing that and relying on hard sciences. It can be quite challenging, but I adore it. I absolutely adore it, and that's why I'm also responsible for the practice management component at Griffith over here. So I also give a lecture to consent and on consent, and I lecture to the supervisors, give them in the mandatory workshop about consent and the different aspects of consent.
Yeah, well, because I mean, for a lot of graduates, they're probably thinking, hey, consent's just about having a lengthy kind of document. You know, do I have to go to the extent of doing a Master's of Law to fully kind of encapsulate all of that? What's your take on that?
No, you don't need a Master's of Laws in order to understand valid consent. Let's put that aside. But you need to understand the fundamentals of valid consent. And what you mentioned about that piece of paper or that document, that consent form, that's not valid consent. That is absolutely not valid consent. That is a piece of paper. It doesn't prove anything. Well, it does help, but it is just one part of valid consent, which is documenting what's been understood, relayed, the various aspects of it. Just signing it doesn't mean that you've got valid consent. Because also remember, Laurence, that consent is a process. So it is not just a one-off or a tick box exercise. I got consent, let's move on. Consent has to be given at each and every appointment. And consent, just as it's acquired, it can be very easily withdrawn. So I'll give you an absolutely ridiculous scenario. So you've done this crown preparation, you've got a provisional crown, and today is delivered. Patient doesn't like the definitive crown, likes the provisional crown. That's it. That's the end of it. That's the end of it. He withdrew that consent for you to deliver that crown for them. And you give them the risks, the alternative, the consequences. You give them all that information that these are the problems with you doing that. And they refuse treatment, and that's the end of it. That is literally the end of it.
Yeah. I mean, yeah, that's the thing. Hey, consent isn't just a full out document and then them just signing on at the end. You have to go through all that verbal discussion so they fully understand what they're kind of getting into, documenting all of that down, and then, like you said, repeating that at the next process again, just to make sure that they're on board and fully understand what's kind of happening. Yeah, because I think for a lot of people, graduates come out and they think that, there's these big procedures I'm going to do. As long as I have this form signed and I have it slightly written out, I should be all covered. But it goes more further than that. So of all these CPDs that you're doing, right, what's had the biggest clinical impact on your dentistry?
As I mentioned earlier, the Masters in Restorative Dentistry that I completed in Newcastle, that had the greatest impact, and reasonably so, because you've got you're doing it full time, you're sitting there, you've got clinical exposure, and you've got a supervisor vetting each and every step in each and every procedure that you are completing with that patient. And in the end, you have to. So at the time, we also used to bring in our patients. So my examination I had 2 professors and a restorative dentistry consultant coming and examining my work. So the patients were in the chairs, and they went there and examined, and you had the case reports, and after that you had the viva, clinical viva. So it was a rigorous assessment, so you had to make sure that everything was done properly, and you could defend it. So it's not necessarily about choosing one treatment option versus the other, but rather being able to justify that choice of treatment using evidence. This is what I did, and this is why I did it. And that is the important part.
Yeah, well, I mean, I want to ask as well, because before deciding on that one and, realizing how much of a scope how much of a game changer it was for you, did you do any weekend kind of courses along the way prior to that?
Yeah, I did a number of courses, mainly, to be honest, in implants with the International Congress of Implantology, the ICOI, and the German one with it, which was the DGCI. And there are various conferences that I had attended. And that, again, the more you watch, the more you see, the more you discover that there is much more to it. There is much more to it. Obviously, as a general practitioner, you're not expected to understand each and every step of adhesion of BIS GMA to structure. No one expects you to do that, but at least you have the fundamentals, because remember, in general practice, you've got all these new products coming out every other day, and then you're being hammered with marketing from different companies. And then you might have also reps knocking on your door and coming and telling you, we've got this fantastic product, look at it, and this is what we claim that it does. And so being able to understand the fundamentals of how things work, but also asking, so cutting out the middleman and asking, where is the evidence? Where they tell you, actually, there's this study that was published, so and then you have a look. And you read for yourself and understand whether this is worth your time or not. Makes a massive difference. Makes a difference between, we're talking about informed consent, now you've got an informed clinician.
Yeah. I think
that raises the bar.
Yeah, I think that's an interesting point, because when I started the King's one, I think that was a big difference for me as well. It was that change in mindset of understanding, of diving deeper. Because one of those things that happens when you're going through weekend workshops, sometimes is just, you get these tips and tricks, that's fine, but you don't really understand how it kind of, why you might be doing it, or, the differences, or being that, what you talked about, that critical thinking that comes into what you might find when you come with this more structured program.
Absolutely, but also you need to take into consideration the source of the information. So whenever something is free, you need to know that the product is you. So the source, academia has its problems. No one can argue about that. But one thing that remains, always going for academia, is that at least you know that you're going to get the least biased source of information, delivering that information to you. There are programs that are sponsored and so on, but again, we're talking about people who will have different sponsors. You've got their integrity. I'm published. I know my stuff. They're not going to endorse something that's bad. So that saves you a lot of time. Tips and tricks are also very good, but what it boils down to is whether you want your training to be a structured one or an unstructured one. So your CPDs in general, if we're talking about the 2 hours, 5 hours, 7 hours, I delivered a masterclass for the Royal College on diagnosis and treatment planning. That was 5 hours. Again, there's only so much that you're going to get from such courses, and it's not fair to expect more. And then you've got ones that are hands-on, but again, it's going to be in a simulated environment. It's not going to be the same as doing that work clinically. The level on top of that, you've got the credit bearing ones like a micro masters. I know Hong Kong University has one, especially in implants, where you do all these online courses and you've got some assessments, and then you get credit for them and certificate from the university and so on. And then the top level would be your clinical masters, where you either do work in your practice and you get that work assessed or vetted as part of a structured program, or you're physically part of that program 2 days, 3 days, full-time 5 days, and so on. See, expectations need to be different, and the outcomes from each one is going to be different. Some work for some people, some don't work for others. It's really down to everyone. As long as your expectations of that course are realistic, you should be fine.
Yeah, thank you for going into the range and scopes of the different types of programs that are out there, because for a lot of young clinicians in Australia, they can't see the breadth of what is available. And I think we're kind of emerging into this this area of more of these different programs coming in. So you've previously mentioned that Tony Jones has been a big influence in your life. Can you talk to me about that and anyone else and why?
So Tony Jones was, if you're referring to the Tony Jones who was my mentor for the fellowship with the Royal College of Surgeons of England. So Tony, part of the fellowship program is that you're assigned a mentor. So that mentor actually vets your whole application and your work and gives you a advice. So Tony was instrumental. So Tony is a private practitioner. He's worked in private practice throughout his career, and it was very helpful to get his insight and his support, really, and direct you in the right direction. But yes, I've had many mentors throughout the years, and each one played a different role at a different stage of my life. Some of them have continued till today. Robert Wassel, that I mentioned for the Restorative Masters, every Christmas I still message Robert to check on him, even though it's been over a decade now since I've completed the program with him. So throughout your career, you're going to find fantastic people, fantastic mentors who are going to help you, hold your hand, and guide you because they've seen it all, they've done it themselves, and you need someone like that.
Yeah, that's incredible. You know, something that I've come across talking to previous guests as well is that sometimes when we graduate from a program, we think that, you know, we can't go back to our academic university people to go and ask for help and seek them for advice. Sometimes we think that we've gone into this new world of clinical and that's it, like, you know, and then we have to rebuild those support networks again. But it's easy to forget that your academics back at university are always there to be open to listen and talk to you.
Well, absolutely. Maintain relations. So many of my students from different schools, they still contact me and ask for advice, or even just say hello. We're very keen on knowing how are you doing and how you're progressing with your career. But even forget about academics. One of the greatest challenges probably after graduation is joining a practice that has someone or a number of people who can mentor you. This is critical, and it could make life so much easier and your journey much more easier by identifying someone who would be able to hold your hand and you know, if something goes wrong, and something will go wrong, that they could tell you, oh yeah, Khaled, step aside now, let me help you with this one, or how you can do this, or I can go to them and, you know, I've got this case, what do you think? And this is important. Till this day, I seek advice from different people, especially if it's something that is out with my comfort zone. In academia here with Griffith, if there is a case that requires a peri opinion, I seek a periodontist. I don't seek, I'm not going to waste the time for each and everything, but if there is something that really requires that advice, there's no problem in that. And the people are more than happy and willing to help, because what goes around comes around. But having that mentor is critical throughout your career at different stages of your career, as a fresh grad, later on as more established clinician, if you're doing your or you embark on that CPD journey, having someone to give you advice, this is the right pathway, this is a better outcome, this is a really good program, this is CPD that helped me a lot. But even later on, once you're an older, more experienced dentist working, you will need people. So our job usually is a solitary one. You're in your bay, your clinical bay, you've got a dental assistant, you've got a patient in the chair, and we rarely get an opportunity to see other people's work. You see the stuff on social media, which can be quite deceiving, because you're only seeing the success stories, the glam stuff. But at this stage of my career, I'm more interested in seeing the failures, because this is when you really learn what went wrong, so that I can avoid it, or how can I learn from it. So having someone, again, to discuss things over here at Griffith, Professor Manaka Abuzar, so she's the head of prosthodontics. Many times I go to her and I ask her, so Manaka, we've got this case, and what do you think? And I'm astonished that 99% of the cases, our opinions are identical, even though I don't share it. And that gives you comfort. So that we need that validation, because you're stepping into an unknown. There are many variables for each patient. So having someone experienced, knowledgeable, doing that, or helping you, giving you advice, makes a big difference, not just professionally, but also mentally and so on. Academia, taking up different positions and so on. My previous boss in Hong Kong who was a professor at Melbourne University, Michael Borrow. Again, you've got an academic who's a specialist prosthodontist, who's head of restorative sciences in Hong Kong, very successful and very humble, very down to earth. And sit with you and give you the advice. And, you've got all these characters throughout my career that I can think of, my PhD supervisors who listened to me when I came up with all the kooky ideas for my project, and they humored me. And we went through some of them, the others were chucked to the side. And again, it worked. So you need people, you need to have people to identify these people to guide you throughout your journey.
Yeah. So have there been any particular struggles that you've had during your CPD or dental journey so far that some of our viewers might not know about?
It's about me personally, I'm not sure, but in general, transitioning from uni to work and practice is a big change. And it could be quite the shocker, because all of a sudden, if something breaks down, it's your problem. So you need to fix it. And sometimes you need to fix it on the spot. That puts a lot of pressure. And you've got the time constraints, but also most importantly, you've got financial constraints, because ain't nobody gonna sit and pay for you to take 5 impressions. Yeah. So you've got a running cost also that you need to be aware of. Later on, if you've got a practice that you own, you're not responsible for the livelihood of a number of people. So these are all challenges. But the fact of the matter is that you're going to come, just like you came across people who will mentor you, guide you throughout your journey. You're going to come across some nasty people. Just a fact of life. Just a fact of life. Being able to manage the impact of those people on you is very important, is exceptionally important. And it will be more difficult at the beginning of your career, but later on you're going to learn to say no, you're going to learn to say no, that's not good, that's not on, you need to step back. And you're going to gain that confidence. It takes a while, but you're going to get there. I have no doubt about it.
Fair enough. So, people ask as well, the journey from where you are with everything that's happening over in the UK, what compels you to come over to, Australia and make this big leap? And how did everyone else around you kind of, agree with you to come on? Because that can sometimes shifting a big lifestyle over is a very big thing for clinicians. So after the UK, I moved to Hong Kong. And I stayed in Hong Kong for 4 years, where I was head of operative dentistry, not pros, head of operative dentistry, and I was assistant dean for undergraduate education. And then from Hong Kong, I moved to Griffith. Again, it was a matter of opportunities. A suitable opportunity was discussed with me with Griffith, and I was like, yeah, well, why not? The beauty of moving from one place to the other is that you get better at it, just like anything else in life. So it's the transitioning from one place to the other doesn't faze me that much anymore. So don't be surprised if in a few years I'm not in Australia, I'm somewhere else. But especially for academics, that is just a fact of life, because you're going to go where the opportunities lie. It's a major advantage of academia is that you could, to an extent, move from one place to the other, because you've got a set of skills that can be transferable to different institutions. That is a major advantage. If I wasn't in academia, things would be much more difficult for me to move. But once you do it, you've got the travel bug. There is so much of the world to see here, Laurence, and so little time. Yes. Well, I think some people have said in the past, there's no greater education than actually traveling to different countries and seeing how they work, because you learn about the culture, you learn about so many different things that you can't learn from just a textbook. Yeah,
absolutely. And you also realize that the students in Glasgow are more or less the same, the students in Hong Kong, more or less the same as the students in Griffith. It's not that different. but also when clinically, if we talk about clinically, the things that are based on evidence are absolutely identical, startlingly identical.
That's
pretty straightforward. Oh yeah, absolutely.
Yeah, I guess because that's a different insight into it. So, what would you say to your budding younger self when you were graduating? Then, what would you say to them now?
Keep at it. It gets better, and take it easy on yourself sometimes.
Fair enough. Well, Dr. Khaled Ahmed, so many more questions I want to ask you. Thank you for your time today. If you got the people know how they can find you or what you have going on in your life.
It's the best way to find me is on my website at www.khaledeahmed.com. You can find all the information how to contact me if you would like to get in touch.
So for our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe, and we'll see you in the next episode of CPD Junkie Podcast. Thank you.
Take care.